Hello and welcome to this week's episode of Uncorked with Funny Wine Girl. This is Funny Wine Girl, aka Janine Luby. If you listen on a regular basis, you know the drill. I always like to say at the beginning how I know my guest, how I was either introduced them or if I've known them for a long time, because I do believe it's important. And I don't mean to lecture. I just like to say it's good to be curious. It's good to be open and to trying new things, getting out into your local community, whether it's at an art event, whether it's, connecting with an old friend you haven't talked to in a while, going to a business mixer, a card exchange. Because for me, speaking for myself, I mean, I grew up in Scranton, I've lived here my whole life. I try to take advantage of as much of that as possible because I like to support local. I like to, and not just local, but I like to support especially women. And you never know how you can help one another. So I'll get to how I got to know my guest a little bit today. It was kind of an interesting thing. And it's interesting timing because today I was just down at Joy World Wealth Partners in downtown Scranton, which was founded by Megan Alpert. Megan was a guest on the show because I met her last year around this time donating blood. She was having a blood drive. I did not know her, but I love the name of her business. I thought, Joy World, that's interesting. That sounds very positive. And I decided to donate blood. Well, she was kind and spoke to me afterwards, as you know, you don't want to pass out. So you're drinking the apple juice out of the little box and you're having your snack. And we spoke. She liked what I was doing. She connected me with people where I was able to do laughter yoga and comedy for a women's group. We've become friendly now, and I'm doing a comedy show at her place in downtown Scranton on the 20th. And I actually moved my financial, my IRA to her too. So now we're doing business together, but she's also been very supportive and helpful. I believe it was her who connected or mentioned Maria Conigliaro. I kind of always screw up her last name. She was on the podcast too, talking about neuro coaching not that long ago. And it was Maria who suggested that I should talk to my guest today. And I should mention I saw Maria today as she was finishing up her blood donation downtown at Joy World Wealth Partners. So I just think it's lovely that I know all these different women and it's like, oh, I know her, you know her. We all try to figure ways we can help support one another. And I think that's fantastic. So without further ado, Maria is the one that I suggested that I get to know Alyse Kerr, my guest for this week. And we're going to get into what it is that Alyse does and how she is helping people. So, hello and welcome, Alyse.
Hello, thanks for having me.
Absolutely. So, yeah, it's funny. I saw Maria today and she's like, oh, really? I said, yes, I'm going to talk to Alyse this afternoon for the podcast. How about that?
So she'll probably be hitting me up for money later today then, right?
I don't know, but but she was happy to hear that because she was like, "Oh, that's cool. I'll be happy to hear the conversation, and how it goes." Maria suggested you because I should say Alyse has a couple different organizations, things going on, and we'll get into that. Alyse is a counselor, so she's had integrative counseling. Oops, I have to put my readers on. Integrative counseling for 12 years, but she started just about a year ago, integrative mind and body. And that is something that Maria said you should talk to her about because there's neurofeedback, biofeedback, body resonance therapy. So those were all things that I have gotten to know a little bit about thanks to Alyse, who wanted me to try out the services. But before we get into those and the conversation and how her organizations work together, I would love, Alyse, for the opportunity just to learn a little bit more about you because you are someone I just met a couple times at your office, but I don't really know much about you or your story.
Some of my story is actually going to parallel Maria's. We grew up in the same town, not too far from each other, actually, went to the same high school. So I grew up in New Milford, same as Maria did. I went to Blue Ridge High School up there. After finishing high school, went to East Stroudsburg University for my bachelor's degree, came back here, went to the University of Scranton for my master's degree, started doing local mental health work in the area. So I worked for other agencies, residential treatment facilities, and then got into doing integrative counseling about 12 years ago. And from there kind of grown in the mental health world and trying to diversify ways that we help people in our local communities.
So when you say, and just so for people to get a full understanding, so when you say integrative counseling, what do you mean by that term?
Integrative counseling, why that kind of spoke to me and why we see that across, some of my companies is wanting to collaborate, doing integrative practices, whether that's something we're able to offer internally, and we do to an extent, but also collaborating with other specialists, whether that be medical practitioners, whether that be chiropractics, alternative medicine, that type of stuff. From an internal perspective, what that means to me is the ability to treat a whole host of different types of people. So, within our practice, we have people that specialize in kiddos. We have people that do addiction work. We have people that specialize in trauma, eating disorders, things of that nature. So being able to treat multiple parts of a person, of a family, and of a community.
And that makes sense because it's never just one thing, or I should say it's rarely just one thing. And unfortunately, a lot of times it's been treated that way, let's say many times, and that's not the best approach or the healthiest for the best outcomes. So let's talk first about, so you have the integrative, you have counseling, and that is your for-profit, and that's been around, you said, for about 12 years. And is that in Scranton and then surrounding areas as well, or
Yeah,
how many
we actually have
locations?
lots of locations. So I started integrative counseling myself in 2012 here in Scranton. We're on 300 Mulberry, right in the city. We're in the same building we started in 12 years ago, just on a different floor. We started off with, I think, 700 square feet. Now we have like 12,000 square feet in Scranton of space. Next location we moved to was Harrisburg. Harrisburg had a kind of a unique, I guess, existence for us, because people ask, oh, how'd you get down there? I'm not from there. I don't do business down there. I don't, I've never lived down there. A little bit about my clinical background is, I guess in a previous life, we'll say, I specialized in working with individuals with co-occurring intellectual disabilities and mental health diagnoses. So the reason Harrisburg had kind of happened was that was a location where we could center behavior support services for the IDD population. So we were part of the IDD community for quite a while before the service definition changed, not to get too technical, but that was how we ended up in Harrisburg. It was just a good central location for us to be able to provide services to a very specialized population. From there, we added our New Milford office. So that's where, Maria and I both grew up. Funny enough, my office is very close to where her parents lived. So we're, stone's throw away from there. So we have an office in New Milford. We have just hit, or we will hit 2 years of our Millersburg office. So that's in northern Dauphin County. So it'll be 2 years in December. One of the expansions that we're most proud of, though, is we do a lot of work in local school districts. And, we can talk certainly about that. But we have outpatient therapy offices in Elk Lake School District, up in Susquehanna County, Mountain View School District, Forest City School District, North Pocono School District, and we provide some of the mental health services at Lackawanna College. So that's, some other unique stuff that we're doing, not necessarily in a traditional office setting, but that type of service that we can bring to the schools and make sure that we're able to touch some more in need folks in the community.
So, and just so I understand that, so that is that a situation where if a child's in school and they're having like something happens, can they go see you then, or is this like a scheduled appointment?
It's a scheduled, yeah. Well, the reason we chose to do this, especially in the rural schools, as you heard, most of those schools are in the rural parts of Susquehanna County, Lackawanna County, is folks don't have a lot of transportation options. So, let's take my New Milford office, for example. It's still a half-hour drive from Elk Lake School. So, let's say you do, you're in a good situation where you have a car, but you've got 3 kids and someone's got soccer practice and someone's got cross-country practice. And then somehow I have to get my 3rd kiddo to counseling and they're all at the same time. So what we did was talk to the schools. They had asked us to come in. Elk Lake was the first school. We've been with them for quite a while now. In ways to minimize barriers to accessing care. One of the things that, we all struggle with is there's not enough of mental health supports out there. So schools took away a lot of the transportation barriers and timing barriers. So, the students are already there for school. So if we're able to see them there, it takes a lot of stress off the families, maybe financially from a gas perspective, from a time management perspective, when you've got, again, multiple kiddos that need to be at different places at the same time. So it's more of the same model you would do here, scheduled time frame that we work out with the school, and we see the kiddo right there in the school the same way we would see them here in the office. So we found that we've been able to see and touch a lot more families going into the schools and try to work through what inevitably is a long wait list to receive services.
Yeah, and that sounds great. Not to get into the weeds of, how it works, but are the school districts like investing in that at all? So are they like picking up the cost of some of that counseling? I mean, just that
They
would be great.
they can. What we're doing from a cost perspective is we're billing insurances there the same way we do at the office. So we treat, again, not to get into the weeds of all of that, but we treat the schools just like we would an outpatient office. So those are actually registered with the insurance companies, and we treat it like an office. So a lot of times the schools have very minimal out-of-pocket expenses to have us there because we're treating it just like if we were seeing somebody here. We're billing medical assistants, we're billing Highmark, we're billing Geisinger, whatever the insurance is. So we treat it exactly the same as if they were being seen here. So that minimizes cost in a lot of ways to the school districts, but allows them to have the service and take some of the load off of the school employees, which is huge.
Yeah, that's great. I want to get to a lot of other stuff, but while we're on the schools, I would imagine, and I mean, we could probably spend a whole day talking about this, the stresses that kids and teachers are under now these days with, and I mean, it's no secret the amount of, shootings and things that are happening in school that are clearly highly stressful that a lot of us, like I was Gen X, that we didn't think about. Now, granted, I know a lot of people will reference older generations where they were doing, bomb drills or whatever and sitting under the, which is stressful too. But of course, there was no talk of counseling back then. Now, at least we have these resources. Um, could you talk a little bit to that as far as from what you're seeing? And clearly what you're doing is so much needed and it's great. Could you address that just a little bit, and maybe even things that parents or the rest of us could do to kind of help while they're waiting for appointments and things like that?
Well, and I think one of the things you can do, first of all, is talk to the school, because there's a lot of folks that don't know what resources the school can or already has in place. One of the biggest things with the school stuff, because that's a newer thing, not a lot of folks are doing that. We were kind of one of the first in this area that really brought the outpatient therapy model into schools, is asking the schools. So always asking the schools, having that open dialogue and not assuming that there's nothing there. One of the things I like that you brought up was teachers are struggling too, and if they're struggling, they're not bringing, their best, teaching moments to kiddos. So one of the things that we do through the school program is actually support teachers as well. So it's not just students that have access to our services. We try to make ourselves available early before the students get there and after they leave, so that if teachers, paraprofessionals, administrators, whoever want to access that service, we have that as well, because we know, again, that teachers are struggling as well. That's why we're seeing, people leaving schools in droves. A lot of teaching professionals are leaving for other career paths at this point. So one of the things that's really important to us with this model is working with the staff as well. Because, if they're, feeling better or they're healthier, they're going to be able to work with some of these challenging students. But back to your question is, again, just having those open dialogues, asking for those resources. A lot of folks we still find are very surprised when they find out we are in the schools. So having those dialogue, and allowing the schools to say, hey, we have this resource, these schools that we're in are growing, we're adding new therapists all the time because the need is there. So as soon as you're communicating with the school, they get that referral in. And a lot of times we're seeing those kids that week or the next week, depending on what day they get in. So it's, circumventing the wait list, because the other problem is, especially when you're trying to treat kids, is you don't want to take them out of school. So there's only so many appointments after 4 o'clock. Even with a practice of our size, which is pretty substantial, there's still only so many after 4 o'clock sessions. So that communication is huge, and learning about what resources are out there, what resources can come to the table. And the more that parents especially advocate, the more likely that schools are going to bring in folks like us to help alleviate that, because the schools are taxed, to the absolute breaking point as well with their own internal supports. Your school counselors are just, taxed with testing stuff, scheduling stuff, the crisis stuff that they're dealing with. So, the more that parents and stakeholders in the community can talk to schools about what their needs are, the more likely that they're going to be reaching out and realizing the importance of having us as a kind of supplemental support in the schools.
Yeah, and that's great. I'm glad you addressed that with the teachers too, because that's good to know that they're able to get appointments there too, which I mean, again, that's got to be for the same thing as for the parents. It's convenient then for them, because otherwise they have to be running to appointments, and that's perfect for them. That's very helpful. It's great. I know that I've heard a lot of people say, oh, the wait is really long. There's a lot, like almost a shortage. So would you say that because of the size of, your business, and you've been fortunate that you have enough counselors that they can, or you still need more?
No, there, I'll tell you what our wait list is. It's still astonishing, so my group, I want to say we're at 68 people, and they're not all clinicians. Some of those might be support staff, which, make all of our jobs possible. So they're just as important as the clinical staff. But our average wait list still runs between 750 and 850 at any given time. And that's after we're doing roughly 4,500 sessions a month across all of our locations. So, from my perspective, there's absolutely a shortage. I wouldn't hesitate to say crisis from a mental health perspective. We're very fortunate that people want to come here. We have a lot of specialized training and therapists here. But by far, all of us are taxed to the absolute max as far as being able to do this just in the Scranton location. Like I said, we have about 12,000 square feet of therapy space, and it's not enough.
Wow.
And
So
unfortunately, insurance companies aren't making it any easier for us to do our thing, whether it's reimbursement rates, whether it's who they'll credential, how they're credential. It's tough. We're fighting for, every square inch, every dime that we can to help the next person. It's rough out there right now.
yeah, and there's obviously I don't see any lessening of the need. I mean, and I think it's safe to say, because the articles have been written out there since the pandemic, the need for mental health support has definitely gone up. And I mean, people were isolated, they were cut off, things happened. So, and I know I'm not like, you're not a wizard with the answers, but what do we do at this point? Because I mean, it is tough. I do marketing work for NAMI, National Alliance on Mental Illness, so I'm aware of this, and I'm a big fan and advocate of talking about mental health to help remove the stigma and all of that. But let's say you get somebody and you're convinced, okay, go make an appointment, and then they go to make an appointment, and it's like 3 months, 4 months, 5 months. What do we do in the meantime? And I don't know, maybe it's even rhetorical because I don't know what we do, but what could you suggest in the meantime? What do people do?
Well, I think, one of the things you brought up, NAMI, is great. What groups like NAMI bring to the table are kind of, I want to say kind of non-traditional services. They have stuff that they can do that I can't do. My hands are tied from an insurance perspective, and that's super, super important, is for us to be able to take the insurances and help reduce the cost any way we can to the folks that need it. NAMI is in a unique position because they have some of these alternative programs, whether it's training stuff. I just was at a presentation maybe about 2 months ago down in Dauphin County, and they had somebody from NAMI there. And I was actually astonished at some of the programs they were talking about, whether it be support groups for family members, direct groups. I want to say someone was talking about a bipolar disorder support group. So accessing resources such as that. Some of the online stuff, can be helpful. We've heard people say, good things, I won't mention any specific ones, but there's a lot of those that are out there. So looking for those kind of non-traditional things. Another way, that we've looked at is group therapy, being able to bring people together. So instead of having one person in a room for an hour, we can have 10 people in a room for an hour, talking about like things. So at this point, we're getting ready to launch a group for adults diagnosed with autism spectrum disorder, which is a really niche area as well. So being able to support a group of people together versus one at a time helps to put a dent in there. And one of the things we have to do here is be fairly strict on like attendance. If you're going to come, I need you to come, because, if not, somebody's on the wait list not getting services. Well, someone's not coming, to an appointment. So, those types of things, looking at those non-traditional things, looking at places that can do those types of things outside of the things that I'm able to do based on restrictions from insurance companies,
Yeah.
grant funded, nonprofits, that type of stuff.
Yeah. And you mentioned some great things there. Like I said, I do help out, or I do marketing for NAMI locally here, so Northeast region. And you mentioned they do have some great programs for peer to peer. So people with lived experience, with the support groups or training programs, mental health first aid, all of that stuff is good support. So that is something I just hope. I mean, obviously, I hope in the future that we can, get over this before it turns into a total crisis. But I mean, who knows, I guess, what the future holds, really. And with, like you mentioned, the barriers with health insurance, that's probably not going to go away. So, I mean, I think the struggle is going to be continued or real, I guess.
Yeah, and I think another resource while you're talking about, stuff like NAMI is looking at your local universities. They have counseling centers. I can say like Marywood, for example, they do throughout the year free or reduced cost testing. So that gives their psychology interns, psychology students opportunities to kind of practice their craft as they're working towards licensure and those types of things, but also gives the community the opportunity to get some supports at a reduced or free cost. And, so different universities have things like that as well. And that's something that we do here. We partner with many local universities to bring in graduate students. So as much as we have graduate students, we offer free services from the graduate students to, one, help alleviate stress from the wait list, but also those folks that are, may not otherwise be able to access therapy because of the cost.
Yeah, that's a great idea that I didn't think of. I know years ago I got a free hearing test at Marywood a
There you
long
go.
time ago. Yeah, yeah, yeah. And one of my little gig jobs is doing standardized patient work at the medical college. So I do know those folks need to learn how to talk to real people, and I think that's great. And they might provide a different perspective or a fresh perspective. And I'm sure I would say to people listening, don't be afraid to try that, because I mean, I'm sure that they can offer some good stuff too. Yeah.
Absolutely. We've had people, once they graduate, oh, can I stay with them? Now they're like a real therapist. Can I still stay with them? We've had, great experience over the years. We partner with Marywood, University of Scranton. We've just developed a new relationship with Wilkes. I think we've done some work with some of the other local colleges, online college, the different schools around here that send us interns. We're happy to help them, but also to be able to turn that around into the community. And like I said, usually the clients absolutely love working with the interns as well, and try to stay with them. They develop that relationship. So there's no difference to them, from me as a licensed counselor to the intern. It's all about that relationship and, working together on stuff. So, that part doesn't matter to anybody other than insurance payers. People are getting the benefit. It doesn't matter from who.
Yeah, yeah, and that is the point. Yeah. Let's transition. I want to talk about your nonprofit. So we talked about the counseling that is the for-profit. Now you said just about a year ago, Integrative Mind and Body Services, is it? I think
Yep.
there's, yeah, services. And that's well, I'm aware of the Scranton location. Is it that one, or do you have additional locations?
We have other locations for that one too. So our main location's here at 220 Penn Ave, so just down the block, which is great. So I get all my steps in walking back and forth between the two offices. So my watch is loving me and knows I'm not dead for once. But we also have a location up in New Milford. Again, that's important to me. That's where I grew up. It's always important for me to give back to local communities, especially one that, made it. I wouldn't be here, without them. So we do have a location in New Milford, and we do have a location in Millersburg, Upper Dauphin County, and we are looking hopefully later this year, early next year, to add the Harrisburg location as well, and to, partner up with Integrative Counseling just from a space perspective to be able to offer the specialized services through the communities that we're already working with.
So people understand it's a nonprofit. I want to talk to you a little bit about that, like why nonprofit, but then also what is different about it. I know a little bit myself, the biofeedback, neurofeedback. Why nonprofit? Why these types of services?
So going back to the big bad insurance companies is why nonprofit. So, neurofeedback and biofeedback, while it's been around for quite a while, is something that's newer to insurance companies, and I think a lot of us that are, experiencing healthcare now is take the pill, here's the Xanax, here's the Ativan, here's the antidepressant. So, insurances will pay, for those. This is something that's a little bit different from your traditional, or what we would consider traditional treatment. So the nonprofit model was basically to remove the insurance barrier. A lot of insurances we found don't cover neurofeedback and biofeedback straight up. So again, making this accessible to people of all socioeconomic statuses was really important to me. So as we were training, we trained behind the scenes for about a year before I even developed the nonprofit. So this was kind of, all in the works, doing the clinical training, and there's a lot of equipment and things of that nature. So it's a fairly involved and lengthy and sometimes costly endeavor. So it just made sense to me. I looked at people who are running this as a for-profit model, and I think that works maybe in areas that have a higher socioeconomic status, but that's not, what I'm looking for. So for me, the nonprofit made sense in the context of being able to give this to everybody. Obviously we're not gonna be able to get to everybody, but we don't want money to be a barrier to accessing this service. So the nonprofit made sense in that way, because again, I'll use an example, medical assistance doesn't cover it. So being able to bring grants to the table to fund folks that have medical assistance, or there's commercial insurances that don't pay for it. So the nonprofit made sense for me with my mission, just a personal mission, to be able to give help to as many people as we can.
Yeah. And I was going to ask about that because as a nonprofit, you can get grants. So let's say there are folks who maybe, even though the prices are fair, or whatever, maybe they can't even afford those because they don't have the money. But can the grants then help folks who are like really struggling with low income, but still could benefit from this?
Yeah, that's our goal. So, where we're at with that is, we are a nonprofit. We've submitted our application for our 501c3 earlier this year. So as with all things related to that, we're still waiting for that to come through. So once we have that, we've started a wait list for that, so we are gathering folks that are interested in grant funding for that. But as soon as we have our 501c3, we will absolutely be pursuing as many grants as we can to be able to, again, give this awesome service to as many people as we possibly can, and do different things with that as well, schools or veterans, whatever that looks like, wherever this crazy ride takes us. But yes, the goal is, once we have that 501c3, to chase those grant dollars and give this to everybody that we can.
Yeah, which is great. And let's talk about how does this, I know you mentioned collaboration. You can't just do one thing. And quite frankly, not the same thing doesn't work for every person, even if they might have, like, this person has bipolar, that person does, but they're going to respond differently to different treatments. So how does this kind of work well or collaborate with, say, let's traditional counseling? I mean, it can stand alone, but it could also collaborate as well.
Yeah, it's a great adjunctive tool to many things. It can be an adjunctive tool to acupuncture, so it's not just therapy. We work with several practitioners of different sciences, of different modalities, and make this an adjunctive treatment. So it can help. I'll use trauma as an example, because at this point, who doesn't have some form of trauma? The bulk of the people that we see here at Integrative Counseling have some form of trauma. The people that we're seeing at IMBS, some form of trauma. So a lot of times, neurofeedback, for example, will make it easier for the talk therapy to be effective. So combining, for example, neurofeedback with, say, EMDR, which, that was a big buzzword for a while as far as trauma therapy goes, combining those two things, making the processing a lot more efficient, quick, and painless for the person that's, working through things. So it's great in that way. It can be adjunctive to drug and alcohol treatment, which is a great thing, and a huge need, especially in this area. So it's a great add-on to almost anything. I mean, there's not really anything that you can't add it on to, or using it as a standalone.
And so for people to understand, and I did have a couple of sessions of the neurofeedback. So that's more about, and I'll let you explain it with the brain waves, right? So that's why it works well with other different, different types of therapy. But, I know for myself, you have the electrodes attached, but would you say you're trying to influence brain waves? Or I don't want to speak for, like, you would know the better way to say
Yeah,
it.
you're not necessarily influencing. So what you're doing, neurofeedback, and why this is such a great thing, because you and I can go in for the same thing. Let's say we both have anxiety, and we go in and we want to do neurofeedback, and I want to work on my anxiety. Well, the way that anxiety looks in your brain may not be the way that it looks in my brain. So what's different, and I always say, about integrative, and talk therapy, there's no blood test. I'm going on what the person in front of me is telling me, and we're working through things from their perspective. It's not like you go to the doctor and you get your blood work done, and yes, you do have diabetes, so it's there. A lot of this is based on, conversation and relationship. What's nice about neurofeedback is the sensors that are put on your head are reading your brain waves, which may look different than mine. So your anxiety might be coming from a different part of your brain than my brain. So if I'm sitting in my office here and I'm doing talk therapy, I'm not going to have that information. So I'm not treating that person from that level of scientific presentation. So neurofeedback, to not put it, not to oversimplify it, is the goal is to make your brain work efficiently. We're not changing anything, but, over the years, whether it's, due to situations we're in, the things that we put in our body, our brain waves change. And our brain wants to work efficiently. So neurofeedback is just training your brain to do its best work. So we're not changing who you are, how you think, any of those types of things. We're taking what you already have and making it work the best that it can. It's really, really cool. You're seeing your brain waves, as I'm sure you have on the screen, so you can see what you're doing in the moment. And then we're using feedback. So that's where the feedback part of neurofeedback comes from. And it can be auditory feedback, so a sound, a beep, a blip, visual, what you're seeing on the screen, and tactile. There's a vibrating tactile that if you like that, you can use that. You can use any combination of those three. You can use one or two. You can use all of them. I like all of them. When I'm doing neurofeedback, give me all the feedback. But basically what you're doing is rewarding your brain for producing the types of brain waves we want it to produce. So, those brain waves associated with anxiety, we don't want your brain to produce those things. We're not going to reward when your brain is producing those types of things. But if we see brain waves that we like, we're going to get a blip. Miss Pac-Man's going to do something on the screen. Your teddy bear is going to buzz. So we're giving your body feedback when it's doing optimal brainwave production.
Mm-hmm. And I will say, for one thing that I'll admit I struggled with, and I had some sessions of this, and then I did some of the, I guess, the bioresonance, is that how you say it?
BRT,
Therapy.
bioresonance therapy.
Yeah. But with this one, I will admit, and this is my personality type. Like, I wanted to be in control, I guess you could say, or to like, so what is it that I can be quote unquote doing?
Yep.
And it was kind of funny. When I was thinking I was supposed to be the girl from Stranger Things, where I was controlling things that were coming. I was watching the screen and I remember I was like, so what am I controlling? Am I like blowing these things up, or these blips that are coming down? I was like staring at the screen like I was doing it. And Amy said no. But it was hard to kind of accept that, because it's like, no, you just sit and look at the screen.
Yep.
And that was a little challenging for me, because I'm like, oh, so it does the work, but I don't feel I'm doing it. Like, you know what
right.
I mean? Like,
nothing's happening. I don't feel like anything's happening. Like,
exactly.
You go on a treadmill and you can feel it. I was on a treadmill yesterday. I'm like, oh, my old legs, you can feel that. This type of exercise you don't feel. And I'm with you on that. So when I started neurofeedback years ago, I was going down to Philadelphia for it, because this is, one of the issues with neurofeedback. It's not something you typically find locally. And Amy was my trainer in Philly back in the day. And I'm like, what am I supposed to be doing? I don't understand. Like, I'm just watching the screen. Like, how do I control it? Am I supposed to be relaxing? Am I supposed to be thinking about this thing? She's like, no, just watch the screen. Like, stop talking to me, so I get you, I want to be doing, like, give me a remote control or something, like do something. So I empathize with you 1,000% with that. And it's interesting, all these years later now that I'll be the one telling you, like, hey, don't do anything. Just watch the screen, listen to the beeps, and feel the teddy bear vibrate. yeah, but for control freaks, it's tough.
It was a struggle, because it's like, what do I need to do? I'm just sit there and sit here and do what? Yeah.
Take it all in.
Uh-huh.
Let your brain do the work.
Yeah, which of course I guess I'm not like used to that kind of approach. So it is different, especially if you've never done it before. It's all new. And as you mentioned, it's really not something that's offered. It's not offered locally besides by your organization. I know you have to go at least, I don't know, 50, 60 miles away, 100 miles away for
the same equipment. There's some local folks doing it on a smaller scale. The type of equipment we're using, yeah, you're a Philadelphia ride before you get near that kind of stuff.
Yeah. So let's talk a little bit about the biofeedback then. And that, because that I got to try too. And that, again, I wasn't doing anything, but I enjoyed that because it was almost like spa, like when sitting in that chair, kicking my feet up. And I was like,
I did it this morning,
just chilling and enjoying whatever's happening.
and that's been a really exciting one, to be honest. So bioresonance therapy. So, I got into neurofeedback, my story starts with COVID. I had COVID, OG COVID. I had it the Thanksgiving before the vaccines came out. So, I had that, and I didn't have it particularly bad, but when I tried to come back to work 3 or 4 weeks later, brain was a mess. So, I had started neurofeedback for, back then for that. Bioresonance therapy for me personally and professionally is new. Amy introduced me to that, and talked about her past life with it. I'm like, okay, and just the more she was talking about, like, I want to try this. So we collaborated with the company down in Florida, and got some bioresonance tools. And there's different types of bioresonance tools. Your bigger hospitals, I want to say Sloan Kettering, I think they have some bioresonance stuff, and some of your bigger Mayo Clinic, stuff like that. They use bioresonance too. So it's not specifically, the devices that you use. I sat in the chair this morning, the same one you're talking about, and, did some work this morning. So it doesn't have to look like that. But what's fascinating about BRT, so bioresonance therapy is what BRT stands for. And it's working on the theory that your cells are putting off almost like a cell signal. So a healthy cell is putting off one type of signal, and we'll call it a sick cell, or one that's not doing what it's supposed to be doing or running as efficiently as it should, is putting off a different type of signal. So the bioresonance therapy is reading those signals and feeding back to your body, those healthier signals. So that's helping your body communicate better. It's helping your body heal faster. And it's been really, really fascinating. So I've changed my own treatment modality to once a week of neurofeedback. I still do, long COVID type stuff. I've unfortunately had a lot of, long-term effects that are pretty manageable at this point, thanks to a lot of treatments. But doing the bioresonance therapy and trying all different things. This morning I had, plates all over me doing, different things. I've had some stomach issues, so I do a lot of protocols around that. And it's really been fascinating how that's worked. And what's nice about it is some of the modalities that we have, we can combine bioresonance therapy with neurofeedback. I don't know if you had the opportunity to double up on those, because there's different types of modalities. We can actually do bioresonance therapy on you while you're receiving neurofeedback. So bioresonance therapy has so many different applications. It's wild to me when I see different things, and we'll get updates, from the folks that design the hardware and software. I think they put out a new PTSD protocol maybe about 3 months ago. So there's always new things, and it can treat things like pain. It can treat things like sleep. Like I said, I have stomach issues, use it for that, headaches, all sorts of stuff. It can be used for helping with side effects from chemotherapy. Those types of things. It can help you prepare for a surgery, or recover from a surgery. Amy had a surgery recently and was able to use that to kind of help expedite the healing process of her ACL, MCL repair. So it's got this, such a vast set of applications. It's great. We've been able to partner with folks primarily in Philly and in Florida that are using this as well, and just seeing modality after modality from BRT, but then the application breadth is just incredible. And it's cool because sometimes you'll be sitting in the chair and you'll feel it. I don't know if you got to feel it at all. I'll have a sensor on my ankle. I'm like, oh, I can feel that. And Amy will say, oh yeah, you're getting quadrant harmonization, and it's hitting your ankle. That makes sense. So it's fascinating to me.
Yeah, I felt some tingles, or like some warmth or some tingles.
Yes.
I tried it like, I don't know, 3 or 4 of the sessions I did that, and one I think was more of like a balance and energy balance. The
Yep.
one day I have heartburn and I take like a generic Prilosec, and for the longest time everything seemed fine, and I haven't changed much. I do 2 cups of coffee a day, probably not supposed to, don't care, I do it. Some acidic white wines, don't care, still do it, and everything was fine. And then a couple of weeks back I had these 2 nights where I was like at 17 million pillows. My nose was practically touching my ceiling in my bedroom. I was up so high, I had horrible nights of sleep. It was terrible heartburn, and we use that. And I'll be honest with you, sometimes with these things you do it once, 50 minutes. Is that what helped me? I don't know, but I did feel good after I left. And there were some tingles, and I will tell you, every single time I felt better, in a sense of relaxed, for sure. I mean, you're sitting in a chair. Gosh, last time Amy gave me a heated blanket. So I'm like, good Lord, this is good.
Yeah, I'm not going to leave, right? So you're going to start getting mail down the street here.
It was pretty comforting, I have to say.
Yeah, and that's one of the things that we're trying to do, with biofeedback, neurofeedback. What's nice is typically the worst side effect you get is relaxation, is better sleep. We could all use that. I mean, I'm guilty of needing a little more of that in my life, but if nothing else, sitting and getting this treatment and relaxing, putting your feet up, have the heated blanket, and just relax for the hour and let your body just kind of absorb this and get this work done. It's incredible. You know, the biggest thing I did it this morning, like I said, and it was funny. We've started a different modality where we're actually using 2 different BRT devices at the same time. And the biggest side effect is I can't get enough water. Like I'm carrying this around all the time. So it's, you know, it's like you went to the gym without having gone to the gym.
Yeah. Yeah, I remember Amy said that every time. She said you might feel more thirsty because other people have reported that. And I'm someone who drinks water constantly, so it was hard to tell.
Yeah.
But I know it was funny. I forget which particular thing we were addressing the one day, and I absolutely felt an increase with that. I forget which one it was, but I was like, wow, I really am thirsty now today. Yeah.
Yeah, it's
Definitely.
wild. And I think my mother had, it was funny when I ordered some of these devices. We have 4 different BRT devices across our locations right now. And it was funny. I think my mom ended up being able to use one of the smaller devices even before I did. She's like, oh my God, it was like immediate. She's like, I couldn't get enough water. So and I'm like, what are you talking about? You know, I'm like, you know, and then I did it. I was like, oh my God, she's right. Like, and then, like I said, doing double, like, so now, you know, we're in the process. We just started over the last couple of weeks of doubling up. Like it's even worse now. And, you know, people will say, well, how do you know what's working? I'm like, well, the first thing I can tell you is I'm thirsty. So, you know, and that thirst comes, your body's flushing out toxins, much like massage, those types of things, you know, so your body's getting rid of the junk. So it needs this, you know, it's working, it's healing. It's, you know, we say, treat this like you're going to the gym. It's wild to me. I'm like, so how do you know it's working? Because I can't get enough water. You know, I just did a marathon's worth of work from a recliner chair.
Yeah, yeah, yeah. And I had for my birthday 2 days ago, I had a deep tissue. So I have been extra thirsty the past few. I mean, boy, did she get some knots. Whoo, baby. I had like tears forming in my eyes, but I'm like, I guess it was needed for sure.
Yeah, right.
Absolutely. What would you like? So here, like we talked about, like insurances are not covering this. Do you see a time, or some of them aren't? Do you see a time, hopefully in the near future, where this will be more accept? Like, although we really, a lot of them don't cover massage therapy unless it's tied to chiropractic, which is kind of sucks.
Yeah.
But do you see a shift in down the path in the years to come that they will be more accepting of these different therapies?
We're seeing blips, you know, and to be honest, you know, everything that we see from an insurance model. So again, integrative, we do insurances. So I'm intimately involved with the insurance life. You know, everything is driven by what Medicare will pay for. So Medicare basically sets the standard for all the commercial insurances, all of Medicaid. And we haven't seen anything yet. What's promising though is, you know, we have an incredible managed care company down in the Dauphin County area, medical assistance managed care company, and they're paying for it. That's an incredible thing to me. So them paying for it before commercial insurance, that's the kind of innovative thinking and putting the needs of your covered members first that I want to see and hope that we'll see more of. Another thing that will really help us is the VA is doing this type of work. So I don't know what specific modalities they're using, but I know they're doing some heart rate variability work, which is absolutely essential, you know, as a foundation for the work that we're doing, and we can all use that in our lives. And they're doing some neurofeedback stuff. So when you're talking about veterans and, you know, some of our most vulnerable members of our population and most needy folks, you know, from a trauma perspective and just the level of care that they need, it's really nice to see that the VA has started within the last year working on this. So I'm hoping, you know, when you see things like that, when you see the managed care company down in Dauphin County saying, yes, we want to pay for this, we're recognizing that there's value in this and that talk therapy is not the only way, or that the pill is not the only way. Those are the things that give me a glimmer of hope. Anything outside of that, you know, we never know. The first of the year comes, let's see what's covered. Let's see what codes we have. Let's see what they're covering. Let's see how codes are changing. You know, we never know. It's a surprise for all of us. The first of the year and typically through the first quarter of the year as they're working out any of the kinks, you know, and things change all the time. I mean, the amount of changes we've seen in Highmark in the last, I don't know, 2 months, 3 months has been crazy. So it's ever shifting. So I have hope. Do I see anything specific that points in that direction? I don't yet, but you know, we just need a few more, you know, of these folks, of these stakeholders to invest in this and to see the value in this, and hopefully we'll be headed in that direction.
Yeah. Well, as you said, you see some hope there, which is good. Some things, if you get more of that, and then, once a bunch do it, everyone will hop on board, I think, which would be the great thing. Yeah.
Yep, we'll get the peer pressure game going there. So if everybody else is doing it, I got to do it too. And I'll take it. I don't care what gets the job done, what gets the insurance is paying. If it's just because everybody else is doing it, I don't care, as long as it, allows me to bring you the service. Because the unfortunate part of this is the cost of providing the services is significantly more than, say, talk therapy. Talk therapy, we have to have, the graduate degrees and the license and all that stuff's expensive. But in neurofeedback, biofeedback, depending on paying and, different things that kind of go on in the background, you have to have that plus very expensive equipment. You sat in rooms over there that had $25,000-$30,000 worth of medical and, computer equipment in them. So the buy-in is pretty steep. And then having to, fight with insurance companies about what is a reasonable reimbursement rate for not only, all the education you're making me have and the licenses and all of that, which is fine, but then to buy the equipment and to, get all the trainings related to that, adds a fairly significant cost of operation to the service.
Yeah. So as we start to wrap up here, one question that I have that I want to ask you, I know you mentioned you do the bio feedback and the neurofeedback, but this is a lot to listen. Like, so you're doing the counseling, but you also have to manage the business side. And I mean, you have to keep up with the health insurance, all that. How do you stay healthy, mentally well?
Yeah, I don't know. I don't know if anybody who's in the mental health field is mentally well. I always say that the sickest person in the room is always the therapist. And that's sure the case in my room. But what I do is a lot of water. That's been something over the last couple of years I don't think I've always been good with. So a lot of water. We actually in all of our offices put in like bevy water machines so that everybody is staying, as healthy as possible. Looking at the education that I'm trying to provide the people that we work with and using that for myself. I have a basement full of gym equipment that I try to use occasionally. I try to exercise, at least go on the treadmill 3 or 4 days a week. Being in downtown Scranton, the walkability factor, I mean, you can't get much better weather than what we have now. This time of year is great. So trying to get out and walk. Again, I do the neurofeedback typically once a week. I try to do bioresonance therapy once a week. I also go down to 220 Penn Ave and steal equipment over the weekend sometimes and take it home with me. And we'll do some training there. Some of the equipment that we have can travel, some can't. So if there's equipment left down there, at the end of the week, I might go down there and steal some and take it home with me. And just trying to be mindful about, eating. Sometimes I don't get to eat the greatest of food, but just trying to make sure I get to eat throughout the day. Try to make sure, I try to get as much protein as I can. Again, that's not always easy, but I'll try to do that with like Greek yogurts and things like that. I'll keep them in the refrigerator here. So it's tough. I'm not gonna lie, I'm not perfect at it. Us as therapists, I always joke with my staff, we're a bunch of hypocrites, so we'll tell you what you need to do, and then I'm not gonna do it. And then I'm gonna whine and complain to anybody who will listen that I don't feel good and I'm tired. And I don't know when the last day I had a day off was, but have you been drinking or eating, or shut up, you don't know me, those types of the banter that we have here. So we're big hypocrites in that way. But for me, the things I try to keep an eye on: water, exercise, the food. I have an app in my phone because that's how I have to work, because I am, running around, different locations, different companies, whatever, to kind of track those things, to keep it in the front of my mind. It sends me reminders throughout the day. Are you eating? Are you drinking? Those types of things. I one of these awful people that wears a smartwatch because, again, it's saying, hey, you haven't gotten off your butt in 4 hours, go move, hey, you still alive, type stuff. So, I do rely on technology, unfortunately, to remind me, when I've been sitting in front of the computer doing whatever for hours at a time, to go do something, get a drink, go talk to other humans, those types of things. So it's difficult. But with the people around here that don't let you get away with anything and my phone yelling at me, I get some stuff done.
Oh, that's good. Yeah. Yeah. No. And to your point, let's face it, I say this all the time, myself included. I think to some degree, we're all hypocrites. I mean, honestly, I won't even launch down that, but we all are to a different degree. So I get it and it's okay. It's forgivable. It's what we do. Right.
Do as I say, not as I do.
Yeah. Yeah. We're all guilty of that in some facet of our life or some aspect. But as we close up now, I just wanted to give you an opportunity, and I'll put in the show notes links to your website. Is there anything else that you would want to talk about or address that we just didn't get to?
Yeah, I would say just a couple of things to kind of keep in mind with the neurofeedback and biofeedback, and I'll use the time to go there because it's something that people don't know as much about. Talk therapy, we kind of have an idea what it is. You're getting little advertisements on your social media, all the stuff that's on the TV. So we know what talk therapy is. That neurofeedback is not going to change who you are. People are worried when you start putting sensors on. Oh my God, are you frying my brain? You're going to make me somebody else. No, no, no. It's non-invasive. We're not putting anything in. We're using what you already have and just optimizing you to be the best version of yourself. Part of neurofeedback can just be used like by professional athletes, CEOs of companies use it just to optimize the way that their brain is working. That can be reducing anxiety, performance anxiety, anger, those types of things, that you might see in professional athletes. So it's a non-invasive modality. It can work for people who have been medication resistant, who've not, who plateaued in talk therapy. So it's just you, but better. So, really remembering that, because again, when you start talking about brain and you see sensors on heads, what are they putting in? What are they not putting anything in, just reading, just want to see what your brain's doing and, squeeze a teddy bear.
Yeah. So don't think a Clockwork Orange. Definitely not.
No, 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 no. We're not doing that. You're still you. Your viewers will see that you are still you, so that's good news. So you're my testament to we're not changing anything. We're just, helping with things that we all struggle with, depression, anxiety, sleep issues, concentration issues, migraines, just, stuff that just are barriers to our everyday. And it doesn't, these treatments don't have to go on forever. It's not something that you have to do for the rest of forever. Once we're training your brain, go on about your merry way. If you need to come back for a tune-up, great. If you don't, that's great too. So it's not something that's forever. It's not invasive. And again, we're not putting anything in, just seeing what your brain is doing so we can address the symptoms that you want to address and get you back to life.
Yeah. And that's great. And it's like you said, it could, maintenance, it could become, right? Like I know for me, my chiropractor is one of my favorite people, honestly. And it's maintenance. I go when I feel like I need to because I had low back issues years ago, and it helps keep me in order, in line. So this is something, do it. And then maybe you can come back just once in a while, like you said, just for a little tune up, or maybe, maybe there's something different you want to address, but it really is something that people hopefully will explore and give it a try.
Yeah, we're seeing a lot of really positive results. We're hoping soon to be able to get some of those stories out, because I think that's really where it's powerful is I can sit here and talk about science, and I can sit here and give you a script of nonsense about biofeedback and neurofeedback. But as soon as you start talking to the people whose lives it's affected, or the people in their lives who notice a difference, when someone comes and says, thank you so much, so and so is their memory is much better. They're repeating themselves less. I'm seeing a difference. My husband's less angry now. Those are the stories we want to get out to people, because those are the ones that matter. It's not, and the stuff I put on my social media or what I'm talking to you about today. It's about the lives of the people that are experiencing the change, whether it's the person like yourself that's receiving the service, or those people that are around you that goes, oh my God, I haven't seen the real you in 3 years. It's incredible to see you come back to life. So that's, that's what we want. So we want to be able to tell those stories and want people to start talking about that, because that's the key to making people feel comfortable doing something that isn't known around here.
Yeah. No, you're right. It's not exactly peer pressure, but like a comfort word of mouth kind of thing.
Yeah.
Like, oh, I did it. Yeah, it's okay. You could try it. Yeah.
All right. They didn't fry my brain. I'm here. I'm just feeling better. I'm just less anxious now. Whatever it is, that's what we want. My mission right now is to help educate people, about the service. Again, it's not something you see outside of the big cities typically. So to be able to bring it here and help people understand it can help, that the risk level is very, very low, and that there are alternatives to all the pills and, all of the kind of things that we have to deal with, on a day to day.
Yeah. Well, I think that's great. And I appreciate you for sharing your time and your knowledge and for what you're doing in the community. I mean, obviously, like we said, mental health is such a priority right now, and it's so needed. I'm glad that you are able to address and help so many people. So thank you.
Thank you.
All right. So thank you to my listeners. Keep listening, of course, every week. And in the weeks coming, I'll have my pal Julie Esty, who I like to have on every week. We'll be talking about her lovely, dearly departed players in the Dunmore Cemetery as we approach scary season. She's always got something interesting with different souls and spirits in the cemetery there. And Emily Hickox of Budget Through Life, who's actually a sponsor of this podcast, will be talking again soon about this time of year can be expensive, back to school, but we always need to be mindful of our spending while trying to balance, of course, having fun and joy in our lives so we're not stressing too much about our finances. We have to worry, I should say, be mindful that we're not making it difficult on our mental health as well. So, those will be coming in the next few weeks. And Lisa, who did a really interesting research project in Scranton about the murals, actually throughout all of northeastern Pennsylvania. I will have her on to share what she learned about the murals. Her goal was kind of to see what they were showing to people, what they seem to symbolize, and if everyone is represented in the local murals. And she'll be sharing what she came up with and also the exhibit that will be coming up in October. So that's what's coming up in the coming weeks. And again, as I say, thank you for listening. Be sure to check out the show notes for the links to Alyse's counseling and to Integrative Mind and Body. And if you are interested in helping to support this kind of content and you're interested in learning more about becoming a podcast sponsor, please reach out to me. And remember, even if you don't have the financial bandwidth, you can help by sharing this podcast. Share it with a friend, foe, or anyone you know, or write a testimonial because I really would appreciate that. So, as I say each week, I appreciate you from the bottom of my heart and the bottom of my wine glass.